Good afternoon, folks. I have discussion aid for you. We are discussing Medicare, Medicaid's things they cover for 2026. So please join me in today's discussion. We will get going in a few minutes as soon as I set up for the show. So bear with me, please, and I'll be right with you. Okay. Here we go, folks. Centers for Medicare Medicaid Services, CMS, has finalized a rule that will prohibit Medicare Advantage plans from covering certain popular supplemental services beginning in 2026. These are services that many MA plans voluntarily offered in 2025 as extras, but CMS is tightening the definition of what Advantage plans are allowed to include. As a result, coverage will shrink, and retirees who rely on these add-ons benefits may find them reduced or eliminated. Just a second, guys. Be right with you. What the article says in plain terms. A new CMS regulation is the driver. CMS has redefined which benefits count as allowable under Medicare Advantage plans must now align more strictly with Medicare's core medical benefit structure. The change applies to 2026 plan year benefits. What you have in 2025 may not be available next year, even if you stay in the same plan. Popular programs are being targeted, while the excerpt doesn't list them. The article signals that many of the wellness support or convenience services that MA plans have used to attract enrollees may no longer qualify under CMS rules. The tone is cautionary. The author urges Medicare Advantage members to verify whether the service they rely on will still be covered. Why this matters for Medicare Advantage enrollees. Medicare Advantage has grown by offering extras, transportation, meal delivery, fitness programs, in-home supports, caregiver benefits, and other non-medical services. CMS is now tightening the guardrails to ensure MA plans don't drift too far from Medicare's stationary benefit design. This means some supplemental benefits may disappear entirely. Plans cannot offer what CMS no longer recognizes as allowable. Other services may be scaled back or restricted, even if a benefit survives. It may come with narrowed eligibility, fewer visits, or more prior authorization. Retirees who depend on these supports may face disruptions. For people with chronic illness, mobility limitations, or caregiving needs, losing a supplemental service can have real consequences for daily functioning and independence. Insurers will redesign their 2026 plans. Expect changes in networks, cost sharing, and benefit structures as insurers adjust to the new rule. What the article implies you should do next: review your plans 2026 annual notice of change. This is where insurers must spell out exactly what is being removed or altered. Check the evidence of coverage. This document gives the fine print details of what is and isn't covered. Call your plan and ask about specific services you use. Don't assume a benefit will continue just because it existed in 2025. Compare plans during open enrollment. If a service you rely on is being cut, switching plans or moving to original Medicare plus Medigap may preserve access. Watch for CMS updates. CMS may issue certifications or exceptions as insurers implement the rule. What to watch in the coming months? Plan by plan announcements. Insurers will begin releasing their 2026 benefit packages later this year. Advocacy and industry response. Some insurers and patient groups may push back or request modifications. State level effects. Because MA penetration varies by state, some regions may experience more dramatic benefit reductions than others. Okay, here's the second part, guys, of today's A. Advantage Advantage MA plans will be prohibited from covering a wide range of cosmetric and authentic procedures starting in 2026, following a formal rule issued by the Centers for Medicaid Service, CMS. The rule draws a firm line between health-related supplemental benefits and appearance-altering services, and it removes insurers' ability to include cosmetic offerings, even if they previously proposed them as wellness or quality of life extras. What the page reveals about the rule. What's banned. CMS now explicitly includes procedures such as Botox injections for facial lines, facelifts, and other aesthetic interventions that do not improve or maintain physical function or health. These services expectation of improving or maintaining the health or overall function of the enrollee. Cosmetic procedures failed this test. So far, they cannot be included in MA bids going forward. The scale of the impact. Millions of older adults are affected. The article cites data from the American Society of Plastic Surgeons showing over 4.1 million adults age 55 plus have undergone cosmetic procedures in recent years. A 28% increase since are categorized as purely cosmetic and therefore outside Medicare's statutory purpose. why this is happening. For years, insurers used flexibility granted by the 2018 Bipartisan Budget Act to propose broader supplemental benefits, including some cosmetic services. CMS had been rejecting these proposals case by case. The new rule uh, codifies those injections into uh, blinding regulation. How CMS defines the boundary. A service must have a reasonable In 2010, this reflects a growing cultural normalization uh, of aesthetic care among older adults. Out of pocket costs will rise. Anyone who previously relied on MA supplemental benefits for cosmetic treatments will now need to pay privately or seek separate insurance. Plans must redesign benefits. Insurers will need to revise their 2026 submissions, which may lead to ripple effects, changes in supplemental benefit menus. Eligibility criteria or how plans market themselves to seniors. Why CMS tightened the rules to restore a clear medical focus. CMS is signaling that Medicare Advantage cannot drift into covering lifestyle or appearance enhancing services, even if they contribute to subjective well being. To prevent benefit creep, regulations were regulations regulators were concerned that some insurers were pushing the boundaries of what counts as a health related benefit, potentially diverting resources away from medically necessary care. To ensure consistency by codifying the exclusions, CMS eliminates ambiguity and prevents insurers from repeatedly testing the limits through new proposals. What this means for beneficiaries. Expect changes in 2026 plan documents. Cosmetic services that appeared as perks or wellness extras will disappear from MA brochures. Evidence of coverage. Give me 1 second, guys. Documents and annual notices of change. Some seniors may need to rethink their coverage. Those who valued these services as part of their MA plans appeal may consider switching plans, returning to original Medicare with Medigap, or budgeting for private pay cosmetic care. Other supplemental benefits may shift as insurers rebalance their offerings. Some non-cosmetic extras, transportation, meals, in-home supports may be adjusted as well. What to watch as implementation approaches. 2026 plan announcements. These will reveal exactly which benefits are removed and how insurers relocate resources. Provider and industry reactions. Plastic surgeons, dermatologists, and MA insurers may lobby for certifications or exceptions, especially for procedures that sit at the border between cosmetic and reconstructive. CMS guidance updates, additional memos or facts may refine how the rule applies to borderline cases, such as procedures addressing functional impairments that also have cosmetic effects. Practical next steps for anyone affected. Read your 2026 annual notice of change and evidence of coverage carefully. These documents will spell out which benefits are discontinued. Call your plan if you rely on any aesthetic or borderline procedures. Ask whether they will still be covered under the new rule. Compare options during open enrollment. If cosmetic or appearance-related services matter to you, you may need to explore private insurance or cash pay options. Okay, guys, that's A for you. I will be back on with B shortly. Give me a little bit, please, and I will be back on with B for you. For now, Gator Wellness, take care, folks.